All right. Hi, everyone. Thank you so much for being here. My name is Esther Kim. My pronouns are they and them, and I work for the Oregon Health Equity Alliance as the Public Health and Coalition Strategist. And I am one of the organizers for this event. So thank you for being here on a Friday afternoon. Um, I'm going to be looking back and forth on two screens, so please bear with me and with that. So attendees, to let you know that there is interpretation. We have ASL on the screen, and then we have a Spanish interpreter. So if you need Spanish translation, at the bottom of your screen, there will be an option for, I think it should be for interpretation or translation. So you can just opt into it and you should be able to hear the interpreter.
Ok, ¿qué tal? Muy buenas tardes a todos. Pues bienvenidos por tenerme aquí. Mi nombre es Esther Kim. Yo soy precisamente, estamos en esta serie de webinarios. Estamos en este taller en entrenamiento, una especie de plática, ¿no? Si ustedes quieren escuchar esta plática en español, pueden por favor marcar en la parte de abajo de su pantalla el globo terráqueo donde dice interpretación y puede decir español. Gracias.
Okay, and I also just enabled the captions, so I apologize for not having that up earlier. I need to make a note of that. Okay, so let's, oh, okay, I figured I had actually turned it off. Okay, Maria, can you hear it now? Great, thank you. Okay, so let's get this going. Okay, so you are all here because we are hosting the Community Conversations on Data series. Today we are going to talk about what is data and why is it important for Black, Indigenous, and people of color communities. So we're going to provide a historical and contemporary context. And this is hosted by OHEA, the Oregon Health Equity Alliance, in partnership with the Clackamas, Multnomah, Washington, and Yamhill counties. All right, some logistics. So we have language access, Spanish and ASL interpretation, as well as the automatic English live captions. And then there will be translated recordings available afterwards on our website. And so our time together will be an hour for the panel, 5 minutes for a break, followed by a Q&A. So before we start, I'm going to give some, well, actually before this, so sorry. So before we talk about who OHEA is, I do want to, I wanted to talk about land acknowledgement just because in virtual spaces, it's sort of an interesting dynamic to think about and talk about when it comes to land acknowledgement. I think it's one thing to be together physically and acknowledge the shared space, the land that we are on together. And I think it would be easy to assume that those of you who are in attendance are in what is known as Oregon. But even then, I know we're all in this virtual space from different places. So personally, I'm here in this space from the Nez Perce Family Land. depending on which tribe you ask. So I think for this land acknowledgement, I was thinking about what is it to make an acknowledgement without a call to action. So today, I invite everyone in attendance to reflect on the way in which you came to be where you are. If you don't know, this is a great time to learn more. Take it upon yourself to learn about where you are, who was here before you, and how is it that you came to be where you are. And if you do know, it's a great time to think about how to meaningfully engage in what it means to be on occupied land. As a Native person, as an Indigenous person, as a settler, as a person in diaspora. So I have to hold space for that. So as I said, I work for so OHEA. What is OHEA? We're the group hosting this set of series. So OHEA is the Oregon Health Equity Alliance. We are a people of color-led collaborative. We're a regional health equity coalition, and we are organized to center and uplift the wisdom of our communities through racial justice-informed health equity policy practices, as well as part of the movement to dismantle white supremacy and shift the imbalance of power. So why talk about data? Data is really important, and it can be confusing and hard to understand. In OHEA's work, we've seen serious gaps in the ways that data is understood, collected, and shared between the state, counties, and for the communities that they serve. Unfortunately, these aren't new dynamics, but COVID-19 has highlighted the precarious balance of our systems, and the data, or the lack of data, is one way we can understand what is and isn't happening. So to be clear, these webinars are not focusing on an analysis of a specific data set. These webinars are part of the work to make data more accessible to our communities. So before we introduce our panelists, I wanted to talk about how they came to be. All three panelists are part of the Bipoc Data Council. Bipoc stands for Black, Indigenous, and Color. The Bipoc Data Council is an emerging collaborative brought together by Dr. Eileen Duval in 2020 to support the identified need to ensure that COVID-19 data collected, that the COVID-19 data is collected, presented, and analyzed was as inclusive as possible and just as possible. The Bipoc Data Council is grounded in the wisdom of Black, Indigenous, and other people of color, and seeks to leverage frameworks rooted in decolonizing and anti-racist practices. So I'd like to take a moment to have the panelists introduce themselves. I've listed you on here in alphabetical order. So Kelly, would you mind going first? Your name, pronouns, and affiliations.
Sure. Hi, everybody. My name is Kelly Gonzales. I'm a citizen of the Cherokee Nation and Mexican. I am mother to Ren and Caleb and a community member of the Portland area Native community, thriving Native community. I am an associate professor at the OHSU PSU School of Public Health, the first Native to be tenured and the only Native working in a tenure track position in the School of Public Health. My pronouns are she, her, and hers. Thank you.
Thank you, Kelly. Alyshia, would you introduce yourself next?
Yeah, sure. Aloha mai kako. Hello, everyone. My name is Alyshia Macaysa. My pronouns are she, her, hers. I'm the incoming executive director of the Oregon Pacific Islander Coalition. Thanks for having me.
Hi, everyone. My name is Dr. Tyler TerMeer. I use he, him, his pronouns, and I serve every day as the Chief Executive Officer of Cascade AIDS Project and Prism Health, and honored to be here with these two beautiful ladies today. These women are incredibly inspiring and have been a huge part of my journey over the last year. So just honored to be here among their brilliance.
Thank you so much. Also, just letting you know, I can hear the interpretation, and so I'm a little bit delayed as I'm listening. So that's just speaking for my the information that I'm processing. Okay. So as we start this conversation at OHEA, we wanted to offer a very sort of general definition of data. So very generally, data is known as facts and statistics collected together for reference or analysis. And I had sent questions to the panelists earlier. Let me pull them up. So before we talk about the prompts that I sent, I would have like if you would all sort of talk about your experiences on the BIPOC Data Council and how that's informed the way that you're thinking about data and what your experience has been in that work. Who would like to start? Should I just call on someone? I'll call on Alyshia.
I'm like, how do we sum up this very challenging but illuminating year of work together in a global pandemic? I mean, the one thing that stands out to me about our formation story and what you were sharing earlier, Esther, is that, you know, Dr. Duval really organized us, right? And really it was this call for support and this deep need to, especially in the face of a global pandemic where we knew institutions didn't adequately serve BIPOC people and communities before the pandemic, and we didn't expect them to do it during the pandemic, right? And so Dr. Duval really made this like bold reach out to her relationships, to the folks that she organizes with, to the folks that she does data and research with, and said, we need to come together. This is a really critical moment for our community. You know, I'm seeing the way the data is intended to be reported, and you know, there's some issues. It's not disaggregated, and the amount of xenophobia that's circulating around COVID-19 like calls for us to really present this data in a thoughtful way. And I'll just say that the important thing that I want to highlight there is just the relationship building aspect of our collective, right? I think white supremacy culture and dominant culture institutions, when we bring up these bold visions to say we have to figure out a way to do this better, to better serve people of color, you know, oftentimes it's a lot of questioning and undermining that of, well, that's not good research, that's not good science, that's not good practice, that's not realistic. And I think oftentimes that kind of culture can drive us into isolation. And if I've learned anything from all the folks of color that I've gotten to work with is rather than leaning into what white culture or what white dominant culture says is an acceptable practice, to no longer feel isolation as researchers and data scientists of color. Instead, what we need to do is lean into our own communities, right? And it was through that collective spirit and that collective support where we said, actually, like, that is very much a valid ask. It's a needed ask. It's a necessary thing to do if we want to successfully address the pandemic. Because I think what happened with COVID-19 is just such a stark example of we literally cannot all get better until we all do better.
Alyshia, would you mind slowing down a little bit?
Yes, absolutely. Thanks for that reminder, Ruth. I'll slow down. I'll look for your visual too. So yeah, that's my reflection about that space right now.
I'll just chime in and say, I'm not one of the OG members of the Data Council. I'm that guy who showed up at the party and just never left and started calling myself one of the council members. And now feel like this group of people are just such an important part of my family, which is also so ironic in the midst of so much that's happened in the last year. I've never actually met anyone on this data council in person. Our entire relationship, or at least mine, with everyone in the group has been virtual, but we've still been able to create such an amazing community and such an amazing connection that is really driving and allowing us to thrive in this very community-centered approach to our work. I was on a very parallel path and seeing many of the same disparities in data, and especially looking at the intersection of folks that were coming from communities of color and the LGBTQ+ community, and was advocating for the collection of sexual orientation and gender identity data throughout the beginning of COVID. And when several large studies, including the OHSU Key to Oregon study, launched, I think it brought our two worlds together. And we began recognizing that large institutions who really had the ability to create some serious change because of their size, the privilege that they have as large organizations, and the money they had behind them, existed in a way that that could create real change, but they weren't creating a pathway forward that was really going to collect the information necessary to create impact on those who were facing the most disparate impact. And we tried politely. They did not listen. And so we came at them hard, and the rest, I think, is history. We've done some pretty amazing work together over the last year as a result.
Feels so good to hear you both talk about our, you know, where we started, where we came together, and why. You know, I think about the being part of the BIPOC Decolonizing Data Council is one of the most important things I've done in my life. I often think about how amazing it is that we individuals found each other in this time of crisis and trauma, and created a connection, a relationship that wasn't driven by money or prominence or titles, or but really about being responsive to the needs of our community and centering on, you know, the love of our community. So I see what we do, our advocacy and our actions of resistance as very lovingly, as very loving and lovingly. I came together with the group in advocacy for the Native community. And we know that before the pandemic, data infrastructure into health issues for Native people is poorly designed or not existent, and that the health needs of our communities weren't being prioritized. We know that data is power. Data is a tool that is on a continuum. At one end, that tool of data can be a tool of liberation and life. And on the other end, it can be a tool of capitalism, white supremacy, and the perpetuation of genocide. So we came together as a collective because of the love of our communities, as a natural extension of our work to help guide our communities through a pandemic and provide like a protections from potential weaponization of data or the lack of data with regard to understanding the needs of our communities. And it's unfortunate that this has to be our role. When I think about the future, it definitely is not about being in resistance to assimilation or genocide from white dominant institutions. It's about creating systems and data that regenerate life, that are life affirming, that are grounded in the histories and the legacies of not just our trauma, but in our wisdom and our collective strength, and beautiful lives. And I'm inspired because this group knows my family. They know my children, and they know the hearts of my children. And that's that measure of relationship that we have. And I have found great, immense support from this group to stay steady in this traumatic and traumatizing epidemic or pandemic. And then in the enthusiasm of anti-racist initiatives that aren't centered on naming colonialism and then moving beyond colonialism.
Thank you, everyone. I feel like you all sort of just went through kind of the first 3 prompts that I sent you, which is awesome. I am, I think as Kelly, you were talking, I was thinking about like, so why, I mean, if the 3 of you would mind talking about like why data collection is so fraught, like historically and now, we can kind of point largely to colonialism, genocide, white supremacy, and capitalism, but what are the gaps in data collection? What have the consequences been because of those gaps? Because I think still, even when we know, we can sort of name like the ways that the medical system has taken advantage of people, kind of thinking about the ways that both data is seen as this neutral thing, and then also as a static thing, but has these actual sort of like alive implications. So I don't know if that makes sense, but interpret it how you will.
Where do we begin?
I know.
Now, I think as you mentioned, research and data as we know it was built on the backs of Black and Brown people within systems of colonialism and within systems of white supremacy and oppression. It is centered in white history. It's centered in white leadership rather than centered in community and or inclusive of the Black and Brown experience. And I think that while we could participate in a completely separate panel of its own on the oppression that Black and Brown folks in this country have faced across the country and even right here in our own backyard, the focus today, or a real-time example of the focus that we could draw, is where we've seen a casual relationship between a lack of data and non-accountability. In real time, specifically, that could be how a lack of data has upheld inequitable relief responses in the impact of COVID-19 on BIPOC communities everywhere, but specifically here in Oregon, and how existing systems have continuously failed BIPOC folks and other communities that have traditionally faced inequities. And I think Oregon is not unique. Many states do not collect the appropriate information that they need to really make decisions about communities that have had the most disparate impact. They don't collect the information needed to tackle the many severe health issues that are disproportionately impacting BIPOC people and other traditionally underserved populations. In fact, this group came together for that very reason. We weren't collecting race, ethnicity data. We weren't collecting sexual orientation or gender identity data during a global pandemic, but even outside of that, we were already struggling to get people to see the importance of data collection. And with that being said, the inaccurate and incomplete data sets that existed during COVID are not nearly as innocuous as they may seem. I think we know that data impacts policies on health, education, on zoning, on resources in and outside of a crisis, but it also serves as an accountability measure. And these identity-specific measures to achieve equity really require accurate and robust data that are going to help us pass legal and legislative hurdles in the future. And absent that explicit data collection, and accurate analysis of things like race, ethnicity, age, language, disability, sexual orientation, and gender identity, but also a community-centered and led approach, new thoughts or community-centered thoughts on how we approach data equity. The concerns that BIPOC folks have surrounding accuracy, accountability, and transparency will only continue to persist across our country and right here in Oregon.
Plus 10 to all of that. I'm like, what more can I say? I mean, I'll just add to what Dr. TerMeer is highlighting and say, I'm just really thinking about, like, I think data and research is really struggling to divorce itself from melting pot theory. Like, real talk, like, we are lumping huge categories of people into one category, like Asian Pacific Islander. What does that even mean, right? Like, think about the billions of Asian people that exist in this world and the complex layers of history, of environments, of colonization, or of colonizing that experience, that's very much present. And for Pacific Islanders, right? I mean, when you're referring to the Pacific Islander community, you're referring to 3 ethnographic regions, right? We have Melanesia, Micronesia, and Polynesia. We're talking 20,000 plus islands. And about 30 plus Pacific Island nations. But I think melting pot theory and the white supremacy culture that's embedded in that also drives this scarcity mindset, right? Of like, well, there's not enough resources and there's not enough space in research for us to possibly talk about and cover all of those really complex things. I think the other thing that, in terms of how white supremacy culture has driven data, at least the data that I come across in health equity work to be so fraught, is using individuals rather than communities as the unit of analysis, right? Early on in the pandemic on a national level, we as Pacific Islanders knew from day one how hard our communities and our families were being hit. When we first started approaching local public health authorities, and luckily that didn't happen in Oregon, because if it did, I would have gone off. But in other areas where we were doing the work, Northern California, for example, one of the local public health authorities responded to our request for increased investments in Pacific Islanders during COVID and said, well, when we look at the numbers, right, the number of Pacific Islander individuals in this county is too statistically insignificant to really justify an increase in investments, even in this emergency situation. And when we have conversations in Oregon on things like the crisis care guidelines, right? The scenario that I pose to folks is, whether Pacific Islanders are 10 people in this state or 25,000 people in this state, I want you to think of Pacific Islanders as an entire community, because that is how we function as people. And what would it mean if, whether it was 10 people or 25,000 people, if 50 to 60 to 70%, whatever the number is, of that whole community is wiped out because of our lack of response to the pandemic, because of the way we've justified Pacific Islander erasure through data and research. And, so that's one of the most pressing examples I can think of that still clearly really irks me because we have to have those conversations. Like, what does it mean to tell a community that they're statistically insignificant to you? And also just thinking about the ways in which dominant narratives drive data and vice versa, right? The other thing I can constantly think of is there's a real lack of intersectional data, like Dr. TerMeer was highlighting, right? So like, you know, data on queer and trans folks, for example, and queer and trans people of color in particular, like that information is really important. We struggle with housing, with job security, with safety, with healthcare access. But oftentimes the narrative that you see driven by data is solely focused on sexual activity, right? And oftentimes those things are framed as risky behaviors, right? But we never get to see data and narratives and stories on queer and trans people of color as it relates to our access and relationship to social determinants of health, of building our own types of communities, right? Our chosen families, things like that. So there's just so many limits to the way data and research is done in dominant culture. But I think if anything, the Decolonizing Data Work Group has showed there's also lots of abundance and opportunity, but we need that community of support to kind of jump and take the risk and say, hey, major institution with all the funding, I'm not gonna do that and I have a different idea for y'all. Like, work with me here.
Thank you for that. What I'm thinking about from both of your shares just now is what would it be like if I was working in the context of public health as an educator, as a researcher, as a decision maker, as an advocate? What would it be like if those working with me understood that Native people are here today in the contemporary space, that we're not just a historical thing of the past, people of the past, that we are more than our trauma, that we as Indigenous people know that we have stories and songs and protocols and relationship with our plant relatives that thrive and sustain life. Like we have those medicines that thrive and sustain life and Mother Earth. And we are self-determined in our wellness, in our ability to take care of each other because of we are tied together through Indigenous knowledge and Indigenous values as a member of a community with responsibility to one another and to our futures. What would it be like if that's where we started? What would that be like? Where would the conversation be headed? And what would then, how would I be able to like create from that space versus, you know, what if everybody believed that historical and intergenerational trauma was real? What if everybody believed that land back is critical to the health and wellness and thriving Indigenous futures? What would it be like to start from that place versus having to inform a system that we are whole and we have songs and we have knowledge, we have histories, we have legacy, we have wisdom, we have futures and a vision for that is inclusive of everybody. You know, I don't want to be putting my energy into that. And, you know, I think that's the power of our Decolonizing Data Council, is that we all share in that perspective and we do our advocacy from that point of view. You know, the continuation of, I guess I want to say is like, what are systems upholding? And what is the justice that they're working toward? Is it white justice? Is it relief from shame and guilt, from colonialism and living and growing on occupied, stolen lands? What does that mean when we bring that into the space of public health and data? And what happens when we reconcile the fact that when Native people or people, I'll speak on behalf of, or in the context of Native people, are not in the data, that is a continuation of colonial genocidal projects. That's institutional and colonial violence that has an impact on me, on my family, on the generations ahead of me and behind me. And that's a lot to remedy and bring healing to. And, you know, my mentor, Jolene Joseph, will say, you know, racism exists because of white logics, and it will end when we make the commitment to do so, but white folks have to really lead that work. Yeah, I think I just really want to try to connect this idea between our health and wellness and the pandemic to these continued forms of colonial violence, including occupied land and what that means to the future of Native people.
I would just add, it's always so powerful to hear Alyshia and Kelly speak. And part of the reason, in the simplest form, I think that we can talk about why data is so fraught is that the definition that we even started this call with, right? The most basic definition that data is about facts or statistics. Of course, it's about facts and statistics, but data is also history. It's our past, it's our present, it's our future. It provides context, it's driving social and political issues, it's how decisions are being made, it's how we're counted as individuals or not counted as individuals. But more importantly, as I think you've heard both Alyshia and Dr. Gonzales talk about today, is, you know, data tells our story. It's a language of its own. It's teaching us about the way that we live and breathe in the world. It teaches us about the way that our ancestors lived, how they breathed in air, their body language, their emotion, their heart, their spirit. Data is healing, and the mainstream data world does not think of data in that way. I think it's important that we acknowledge that data truly can be a tool for racial justice, but also in the wrong hands and or context, it's a weapon that has often been used against us.
Thank you, Tyler.
I just want to add to that real quick. Yeah, because I think of what is data, you know, and, you know, I'm trained, we're all trained in Western institutions of higher education. And there's a role for those Westernized methodologies. But if we don't critique the limitations of those methodologies, we continue to cause harm and damage to populations. And when I think of data, I'm also thinking about, you know, like, I'm thinking of it as a tool of self-determination. And one of the principles of self-determination is resistance to assimilation. I'm thinking of data as song and story and knowledge passed across generations. And I'm thinking about data as accessible to everyone. It produces knowledge. It produces understanding within and about a particular context. It has an orientation. It has the ability to help us understand a way of living. And it has like influence. And it can be life affirming and life generating, or it can be harmful.
Thank you, Kelly. Thanks, everyone. I was taking all these notes as you were all talking and agree with everything you're saying. And thinking about, you know, what I'm hearing is what you're getting to is this sort of neutral, sort of inaccessible institutional data is like a colonized data, a colonizing data. And it makes me think about something a friend, their name is Corey, has said many times is, you know, is the work in service of reform or is the work in service of liberation? I think when we really have to think about what are the strategies of how we're going to show up, especially when the container we're in is often a very like white, colonized, and often violent space that we're trying to do this liberatory work. So as you're speaking to the futures and visions and data being created and collected by the communities that come from, will you also, can you speak to the tension of the importance of data collection and having like representative data and how that sits alongside the mistrust that historically data has often and continues to be collected by the government, by institutions that are not necessarily connected to those communities, and how I don't think they're necessary. I think they work very closely in relationship to each other. The tension is so present. So what are your thoughts on that, if any?
I got plenty of thoughts on it, Esther. So, you know, that's our first step in the Pacific Islander community. We're so used to, at least in Oregon, that's the context that I can speak to, having our data be totally disregarded, framed in such a harmful way to where there's so much judgment and onus on our people of, oh, why don't you want to be healthy? Why don't you do healthier things and live healthier lives? And so that's our first step, right? And we're there, and I don't have a timeline on it, right? And it's really hard to describe, especially in a dominant culture environment, especially in English, like what that metric even looks like of like, hey, we got there. We have the relationship that we need between Pacific Islanders and between data. And the folks who are doing that data and research work. So like right now, Oregon Pacific Islander Coalition is engaged in Oregon Public Health Division's data modernization work. 3 years of intentionally oversampling the Pacific Islander community with the BRFIS, the Behavioral Risk Factor Surveillance Survey. 3 years of intentionally oversampling, hundreds of thousands of dollars. Strangers in English calling our aunties and our uncles from landlines, from zip codes they don't recognize, asking them very personal questions about their health behaviors. What does all of that result in? 3 years, hundreds of thousands of dollars spent, 106 Pacific Islander responses collected. What's the policy and program impacts of that, right? Well, we haven't gotten any. There's no, you know, there is no robust Pacific Islander health equity initiative or programming at the state level. But rather than jumping immediately into, cool, well, now let's collect the data. Now that we know it's a problem, let's collect the data so that we can get to that piece. And what we've really had to do is build a relationship with the state to say, hold on, wait a minute. Like, before we give you this information, before you extract this from us, you know, to again, reconcile your own institution's past with settler colonialism, like, let's just talk about relationships here. And so we've put them through a very slow and arduous, but very Pacific Islander-led process at the same time on, well, you know, we want to know that you're about what you say you're about when it comes to transparency, when it comes to, you know, really letting go of control over this project and trusting in our wisdom, also recognizing that we are very much data scientists and researchers in our way as Pacific Islanders. And that doesn't always look the way dominant culture research looks like, but you have to trust that we as Pacific Islanders know what is healthiest for us as Pacific Islanders, and that we know what the most meaningful health metrics and stories are. And certainly, given the context that we're in, we want to partner with the state to figure out, like, well, how do we move through this reality that we're working through? But you know, it all started with relationship building. It also starts with Pacific Islanders reclaiming their right and expertise as data scientists and researchers ourselves as well, right? So it takes all of those things, and you know, it's also about, I think, humility, like knowing what the limits of our knowledge are. You know, and for the modernization work, for example, you know, we're not doing no community-based participatory research model. Like, we're not participating in anything. We're going to lead it. Like, give me the budget, then we'll do the work, you know? And so, but like all of the administration and logistics behind it, the things that don't always feel like the sexy work, like that stuff matters. Like setting equitable and relationship-based conditions to do the data and research, right? Like, where are the numbers? Who are you compensating? You know, I, as the community lead, very much got to make final approvals on the budget and determine how we spent and invested our money, right? So I was like, well, rather than spending all of our funds on like Western recognized researchers, right? And then investing a whole bunch of training in them to learn about Pacific Islanders, why don't we just build the capacity of our own Pacific Islanders? Let's create community research workers, you know, and I think that was important, right? Because we had really tough conversations, especially with our elders, you know, generation to generation, on how our elders view queer and trans people, for example. Now, if you had researchers not in there from the community, I think those data workshop conversations would have gone really differently, where they would have been like, oh, well, you know, I don't want to offend. This is me trying to practice my cultural humility. And, you know, instead in that research, we're like, well, let's dig into that more. Like, why do you view queer and trans Pacific Islanders in this way? And what is, like, how can we maintain our relationships with each other despite in the face of our religious and political differences? And like, what's a meaningful path forward for our community as Pacific Islanders? You know, but really, you know, we had a really great partnership with Dr. Margaret Braun over at the state, where she also knew that the data itself was secondary to the relationships that we were trying to rebuild, because of like the history of harm and how deep-seated that was. And so it really, I just can't emphasize enough to white dominant institutions how much brilliant work happens when you just like release control and let people do the innovative and brilliant things that communities do for themselves.
Yeah, I think this is also, well, amen to everything you just said. And I think it's also, for all of us, just so layered and complicated, because we also can't do this without large white-led on institutions. And it requires us to have the time and space to do the work in the way that we're truly going to reach people, but also for, I'll just say, call a spade a spade. It requires them, it requires many institutions to stop putting up just unnecessary and ridiculous barriers, right? Like, how many times have we been told, well, show me the data that shows that this is a necessary action? Well, we're asking you to collect the data, so of course there's no data to prove what it is you're asking. Or often in our conversations around sexual orientation and gender identity data, folks get very nervous about, you know, well, these are inappropriate questions for us to ask, or not, these don't apply to everyone, so why should we ask them? And I'm often in a place where I say, well, everyone has an orientation. Like everyone has a gender identity. It may not be LGBTQ+, but they do have an orientation, and there are ways to ask these questions appropriately. And if you don't know how, there are many people who do. So why not rely on the expertise rather than throwing up continuous barriers or continuous challenges to collecting the data that will really make a difference?
Absolutely.
Absolutely. Thank you both. I just want to build on what you're both sharing here. You know, what you're both sharing is that the idea of decolonizing and doing research and data-informed public health is coming from and driven by community is possible. It's already happening. Yeah, and but it's not happening much because of the barriers. And so one experience for one community in this right direction is not enough. You know, I think about the Native community and the work of the Future Generations Collaborative over, I think, maybe the last 6 years with Multnomah County Health Department, Public Health, Maternal Child Health. You know, there were a few select folks from Multnomah County that were willing to take a step back and believe in the conditions that the Native leaders in Portland were setting down. You know, that Multnomah County came to the Native leadership and said, we have funding for a project to address these disparities in maternal child health. And the Native leadership said, thank you, but we're not interested. We weren't involved in that planning. But if you're involved in healing work and building a relationship and understanding about the lasting impacts of historical trauma and the way it manifests in our communities' lives today, how that is upheld within your very system, and then are committed to move beyond that and start to dismantle and heal those traumatizing, damaging aspects of your system, then we're here. And those brave couple of folks, Heather Heater, really in the lead position in that work at Multnomah County, Dr. Duval, Jessica Guernsey, others, you know, took those courageous steps and went against even their own institutional culture to try something different, which was relinquishing that power and that domination over community to step back and say, okay, we're gonna let you lead. We are going to figure out what humility is. We are going to go through a decolonizing process, and we're going to trust the process, as Jillian Joseph reminds us all of the time. And we will learn patience, and we know that we don't have to have all of the answers today. But we're moving through that process that's going to get us to a better way of doing things, better relationships, a better system of doing things. I struggle in this work because I work in a higher academic setting that has a lot of need for decolonizing and to understand its own conditioning of white supremacy. I would love to see the Indigenous health concentration be fully implemented, fully invested in. I would love to see Indigenous health be fully invested in at all levels within our state and beyond, and within our public health institutions. I would love to see a commitment to our future generation of public health workforce that understands and believes in, is centered in a type of justice that's affirming for BIPOC folk, for our good futures. Also, we in the Future Generations Collaborative, we have been training community health workers. We're in our second round and we're leading that work from our community. It's so exciting. And those folks are the leaders in it, who are going to be at the next panel that we have for the BIPOC Decolonizing Data Council and talking about data justice. It'll be other people from our community, filling in these spaces and expanding this work in ways that we haven't even thought about yet. And I'm so excited by that. But we're investing in our communities, and I think just the power of knowing that it's possible is, something to remember. And, I don't always have a tool. People sometimes just like, give me a tool for decolonizing. What is that? Just, Jillian and I were presenting at University of Michigan, and we asked a group of students and faculty in a room to decolonize the room. And there's various levels and ideas around decolonizing. In its ultimate form, it's land back. But we're in a workshop, we're in the space, we have chairs, right? And the participants were hesitant. And we finally had to say, okay, we're gonna leave the room. We're gonna step back over here. We'll be back in 5 minutes. And you all just go right ahead and decolonize the space. And when we debriefed, they had moved their chairs, but when we debriefed, they were a little angry, a little frustrated. They wanted the answer. They didn't want to go through the process. But, we created a space right there in that moment of learning and experiencing the challenges of decolonizing. And we did it together and we moved through it. Yeah.
Thanks, everyone. I think we're going to wrap up the panel section of this. So if there are any last thoughts or comments before we take a break, and then we'll come back and do the Q&A. We have a few questions from the attendees.
Yeah, the last thought that I have many, but the last one I'll share in this moment is, I think when we talk about, just data collection and just work around data in the state of Oregon, we really have to sit in this conversation around statistical insignificance and connect that to Oregon's history as a state and how it formed, and the laws that were in place that intentionally drove the demographics and the numbers that we have now. And again, I was anticipating that, having to have that conversation with major institutions in the beginning of the pandemic. And I'm very thankful it didn't happen, but we still had our own body of challenges, right? But I think, anyone doing this type of work in Oregon very much has to keep the history of Oregon and the formation of the state front and center when we talk about things like small numbers or a lack of representation, or, people of color aren't coming forward to vocalize their needs, or we're just not seeing it. And we're yeah, well, that's all by design. That's on purpose, not just because of dominant data and research practices, but because of the history of this state. And I think that's why multi-generational work is always important, to consider history and root all of our work in understanding the impacts of history. So that's one thing that I'll just name here.
Yeah, I couldn't agree more, Alyshia. I think my closing thought would echo that greatly, and just say that often in those moments, we're also put in the place where we then have to legitimize why our opinion matters.
Yeah.
Why it's important that the data is collected, why the approach that we're encouraging or demanding that large institutions take for reaching our communities isn't necessarily a new way of thinking, but it is the way that our communities have lived and breathed and communicated and collected data and shared stories and experiences for generations. and that if they are really truly committed to diversifying their way of thinking, if it's a new way of thinking for them, not for our community, that they're going to have to be open to letting the true community experts who are members of the community, who may not have a PhD after their name, who may not be leading a large organization, truly let them lead.
Gosh, so many thoughts, so many thoughts. Well, I guess what I am thinking about is, well, we've just come through a really traumatic year. And such a deep reveal during the pandemic that we already knew. But, you know, our public health systems data as a tool of public health is not safeguarding the lives of Black, Indigenous, and people of color, queer and trans folk. And that needs to change. We can't facilitate that change on our own. We have to do it as a collective. And I'm very serious when I ask others or institutions, folks that I'm working with in various institutions, what is the justice that you're working toward? What is the future that you want to see yourself, your children, your children's children, and all communities in? And as a field of public health, if we don't name colonialism, settler colonialism, then the equity for populations that live and suffer in colonialism, the lasting impacts of colonization, our ability to achieve and advance health equity is inconceivable. And it's no joke, like that's real. And I want everyone to know that and appreciate that, but not get stuck in the challenge or the trauma or the discomfort or tension of that. We have to, and Alyshia, you said this in one of our calls, we have to believe that liberation is possible. And to really check ourselves on that. Like, I know as an Indigenous person, my ancestors didn't have the word liberation because they were before colonization, because they were already living in that context. And so that was the place that they dreamed and moved forward and grew old and had babies and made babies. And I would love for my idea of equity to be in reference to that versus in reference to trauma from ongoing settler colonialism. And I would like our data to reflect that. And I think it's a bold and ambitious and beautiful vision, but I truly believe it's possible. And I'm ready to get to work in that. Join me, come with me. Come with us.
Thank you so much, everyone. This has been such a incredible, blessing of a conversation to be part of and to listen to. I think we're going to take a few minutes. Right, my time right now is 4:09, so we can come back at 4:14. So if your computers will pause the recording, we'll come back if we have a few questions to answer. So we'll see you all in 5 minutes. Soon. All right, everyone, we're gonna come back. And it looks like we have 2 questions from the audience. just wait for for Kelly to get back. All right. So the first question is, I would love to hear how OHEA and the council have approached the intersectional ways in which BIPOC people with disabilities are disproportionately impacted by access in social determinants of health. I love that it was mentioned and about looking at the intersecting identities have impacted the ways in which we look at data for health equity. Let's start.
I can jump in, I quote Dr. Duval very often, but that's because she's literally taught me everything I know about data and research and given me a lot of space to grow in this work. And the quote she says is, "You will not find what you are not looking for." So if we are not asking questions about intersectional experiences, like what it means to be a person of color with a disability, we're not going to find that data. And when we don't have that data, we don't have those resources, right? To invest in that community, to support important folks in our community. And I'll just say in full transparency, like my disability justice framework needs work. I'm very familiar with, and I feel very comfortable and confident in my work in organizing and doing research around what it means to be a queer person of color, because those are my personal experiences. But my lens and my framework is very much missing, I think, or like needs to be strengthened. That's a place where I continue to need to be challenged in my work. I will say, in the Pacific Islander data modernization work that we did, or that we're currently doing right now, if we were going to start to ask questions about disability, then we also knew that we needed to set up an infrastructure of support to have those folks participate, right? So even though, for example, Real D data collection was not necessarily a requirement when we were doing our data work, we added it in anyway. We said there's important questions around disability here. And also when we're asking folks to fill out the questions on what disabilities they're experiencing, let's also trigger a service question connected to that of like, if you're hard of hearing or if you're visually impaired, like, would you prefer to do this assessment, this data collection project in a different way? And for our team to be ready to do those things. So it was about setting up all of the support and care and infrastructure needed so that folks can participate in the data collection process, right? Because it's not enough to just even ask those questions. That's just the first step. But I think there's an important thing being brought up here too, which is that, I worked in affordable housing for a long time, and, it's rare for affordable housing to be available and accessible, right? We're talking years-long wait lists for low-income people in the state. There, at one point, a few years ago, there were 112 new affordable housing units available. Only 2 of them were wheelchair accessible. Right? So you think about the challenges as a low income person to find affordable housing. And then you look at that at the intersection of what it means to be a low income person who needs a wheelchair accessible living space. Think about the limited stock of housing available to that particular community. But we need to start asking those questions, right? Of like, what people's experiences are when it comes to disability and what their needs are and what's working for folks. Like, what do we need to further invest in? But like I said, again, one, it's a framework that I very much need to improve on, that my community needs to improve on. And 2, it's not just about asking those questions. Like I said, it's about the way we collect that data. We have to make the research accessible to people too, in terms of how they participate, right? Because if they literally cannot answer the questions and we didn't set up the support in our research project to do that, then it was really all for naught.
Yeah, I think that's so important. We often spend so much time working so hard in one specific area that we become, quote unquote experts in that area. But then we have these very humbling moments, I think, where even as people who are doing this work every day, you realize that there are other intersections of the work that you need to expand your knowledge. You need to expand your base. I'll also own a very recent example, as I said at the beginning, am very proud to be the Chief Executive Officer at Cascade AIDS Project. And we have done a lot of really good equity work. We also have so much more work to do. And as a queer-led, BIPOC-led organization, we're doing some great work to challenge ourselves to grow in the areas that we need to around the intersection of race and LGBTQ+ identity. But recently, I was in a staff meeting and was talking about several of the new affinity groups that we're launching within the organization to support staff at different intersections. And I was approached by a group of staff, not in a harsh way, but just in a way to challenge my intersectional lens by saying that the organization is creating all of these affinity groups, but what about an affinity group for fat folks, or a affinity group for people who have an other disability at the agency? And that we don't, when we talk about our equity lens, when we talk about our equity framework, it doesn't always include all those areas. Mm-hmm. And the example that I think struck my core and has really changed the way that I've been trying to approach the work in the last few months since that moment was one of our staff who identifies as a fat queer woman, very proudly, said to me, "We host an event every year for our volunteers. It's mandatory for our staff. It is 5 hours long, and there's not a single chair in the venue that you pick that I can sit in. It will not hold my weight." And she had never shared that with me before, but it was mortifying for someone who has done so much work to try and make sure that we create safe, affirming, and inclusive spaces. It was not on my radar in the way that it needed to be. And I think it's a prime example that we're learning in this work every day, even those of us who do it every day.
Yeah, and Dr. TerMeer's example too is making me think of times when these frameworks, right, of like BIPOC's grassroots way of showing up in spaces and this disability justice framework, like somehow folks put those two things in tension when they shouldn't be. And I think like the really simple example I can give is like, there's been such a huge debate in our community of like, oh, well, like, do we want presentation slides for these things? Like, that seems like a really like colonizer, like lecture academia way of approaching this conversation. And then we're like, y'all, it's an accessibility thing. Like for folks who are visual learners, where that's supporting their participation, like we need to have that up there. And, we got so much critical feedback on the way that, again, not just collecting the data and how we gave people access to respond, but also reporting it out, right? The colors we choose, the font sizes, like there's just all of these different things that really go into like equitable and just research. And oftentimes they're not the sexiest things that, folks like, I want to be in like the big theory world. I'm like, great, I love that. And like, let's literally talk about like, what does the survey interface look like when you open it up? Or like, who's going to be making that phone call? And does that person know how to ask questions about someone's gender identity, about someone's disability, about what kind of needs they have to support them in participating in this work?
Kelly, did you want to add anything?
I'm okay. I'm looking at time also, so I want to be respectful for that time.
That's I think we have like, I think we have 4 questions and we have 6 minutes. Oh, I hear you. I mean, I will just very briefly say that at OHEA, I think COVID has been an experience where access, we have all had to contend with our access, or what our access needs are, what we need to be able to do our jobs, and also really feeling the pushback, flashback from sick and disabled communities who have been asking for quote unquote like accommodations for a long, long time. And we've been told over and over that it's not possible, it's not productive, you either have to conform to X way of being or you can't participate. And I think that's a huge lesson that we need to remember, especially as more and more people are going back into offices that maybe not everyone can go into. To Tyler's point, that people can't physically be in. There's a lot, and I think overall, it's really important for all of us to not be afraid of accessibility and disability, because I think that is the place that people get seized up, because it's like, well, I don't want to say the wrong thing, but like, I think we have to really challenge in a sort of decolonial framework around like, why have we been told that X thing is neutral and that we all have to sort of conform to that, versus thinking about like, everybody needs something different and that's okay. And what's iterative in that.
Yeah.
I just wanted to speak to that really quickly.
And just one more thing, building off of what you said, Esther, I think we can't wait, right? We like folks have been asking for these things for a really long time. So in the way we do our research and the way we do our work, we can't wait until, oh, there's a person with a disability here. Now let me make this project accessible, right? Or like, well, no one showed up to our project last time. You know, no one showed up to the data workshop who needed like wheelchair access last time. So why do we have to pick that venue this time? You know, I'm like, well, that's a self-fulfilling prophecy. Like when you don't create that space, those folks aren't going to show up. So we need to do it like, you know, now and then, right? Just like the way like integrating our pronouns. I mean, it's such a small action, but it's an important one, right? Because you don't want to just ask the pronouns of trans folks or non-binary people. It's just a piece around like good practice to invite that conversation, to bring those folks into that space. And so I think the same thing goes with disability justice, right? Like we can't wait until disabled people with disabilities come in and say, hey, now I want to participate in this research project. We're never going to hear that if they don't feel seen and supported. Like why put them in the position to do that labor? You know, I think it's a responsibility of all of us for us to think about like, well, like how do we resource this in the most intentional and accessible of ways?
Yeah, I agree.
I do want to add something to that as well. I feel inspired, but in terms of the, like patience and waiting and justifying, you know, we don't want to, so we have an opportunity now through, right, some of the blessings of COVID is that we did see that deep reveal of where the system and the foundation is lacking, where there are gaps, where there are harms, where there are need for new building blocks. And the time to do that is now, not when we're in another pandemic and when we're in crisis mode. When our communities are triggered and re-traumatized from a crisis, the time to respond is now. And I think it goes right back to what is the justice that you as an individual or system are upholding. What does that justice mean? What future is it advancing? And what are you willing to commit to in that work, in that vision? Yeah, I think that's about what I want to say.
Thanks, Haley. Okay, we have 1 minute. I'm going to throw this question out. So time and again, I see dominant culture leading the data/epidemiologist work, prioritizing quality improvements of workflows while simultaneously collecting incomplete data. Then I see them leaning into the data gaps as an opportunity to substitute the American Community Survey and vulnerability indices to justify making inferences regarding a particular community. How can data democracy be incorporated in a practical way? Came from a data person, I think.
I will just jump in and say, that the first time, I'm going to talk about Dr. Duval again. The first time I ever met Dr. Duval, I was a program manager for affordable housing work. We were looking at birth outcomes in the 97266 zip code, so Lentz in Multnomah County. And I sat down with her because my executive director said, this is going to be your resource for data. This is going to help shape how we're going to approach the work for the community. I sat down with her and I said, hey, can you show me the birth outcomes data on this zip code? And she says, well, I could pull that data for you, or you could tell me what story this community wants to tell. And she's like, you direct me. I'm the epidemiologist. I have the access, the resources, but I want to know what the community wants to know. And I was like, I have never been asked that question by an epidemiologist before. And I didn't even know that we could ask that of epidemiologists, And so from the working relationship that I've had with Dr. Duval over the last few years, and what I've been advocating for at the state level is like, data must go through community validation processes, and we need to build in an infrastructure like that. We as communities of color cannot afford to stumble upon the one woke epidemiologist and ask her for all of her time and labor, because she does incredibly brilliant work. She's built data matrices for our communities showing how information on race and ethnicity is collected. She's transformed existing data. We didn't even have to collect new data. We just reframed the way data was reported, right? Where we know now 92% of our COFA citizens birth babies at healthy birth weights. We're like, cool, well, let's ask those 92% of folks what's going right for them, and then build programs and investments around that, rather than being like, oh, you're not doing what white folks are doing, so how do we close the gap between those two populations? But we can't afford to stumble upon the Dr. Duval's of our lives by chance. I actually think the way she approaches this work needs to be institutionalized, right? Community validation, creating an equitable distribution of power between community and EPIs to say, building the community's capacity and understanding to say, actually, you can demand things of data and research, because at the end of the day, it truly is not neutral, right? In the way we collect and report it. And so that's what I would love to see infrastructure and systems built around, because it can't just be like, the EPIs are like at the top of this hierarchy and the all-knowing power of like health outcomes for our communities. It doesn't work that way. And that's what I'd love to see some investment in.
I think building on that, I would like to see the same orientation let me back up. I'd like to work with epidemiologists that asks, and other researchers that ask the central question, how is this work building self-determination and sovereignty for Indigenous people? That's what I would like to work within that kind of framing of research.
Taylor, do you have any final thoughts?
I think my final thought, which is somewhat related, but also I think is just an important driving point, is that there are people who sit in positions of power that are not aligned with this work, and they never will be. We've tried the easiest ways we know how, which are those methods in themselves are grounded in systems that we are trying to dismantle, but it's the way we know how to often approach those folks. And we have tried to speak that language to get them to understand the importance of this work, the importance of the approach to community-led, community-centered work. And the only way that we can really make a difference in some of this work is by getting those people out of those positions of power, by elevating the brilliance of people like Dr. Gonzales and like Alyshia and like Dr. Duval, and folks in our community and getting them into those positions, or people that are within our BIPOC networks into systems, into positions that can make decisions that will ultimately change the way we view this work, the way we collect data, the way we report on data, and will only allow our communities to thrive in the future by doing so.
Thank you so much, everyone. I know we're a little bit over time. We held on to the majority of participants throughout, and it was a pleasure to hear you all not only talk about this, but be able to witness the relationship that you have with each other and the work that you're doing. That was very powerful, and I appreciate you sharing that space with us. For participants, we did have like 3 more questions that we didn't get to. So OHEA will do our best to get those answered and shared out. And then the next 2 Wednesdays, we have our following 2 conversations. So be there. We appreciate you all, and everyone have a great weekend. See you soon.
Thanks, Esther. Thanks, everyone.